Aggrastat uses, side effects, and precautions. Aggrastat tirofiban is a medication that belongs to a group of drugs called antiplatelet agents. It is used to prevent blood clots from forming in the coronary arteries. The drug is commonly used in patients experiencing unstable angina or acute myocardial infarction. Uses of Aggrastat prevents blood clots from forming in the coronary arteries. This helps improve blood flow to the heart. Reduces the risk of cardiovascular complications such as heart attack and stroke. Assists in the treatment of unstable angina and acute myocardial infarction. Potential side effects of Aggrastat. Aggrastat, like many other medications, can cause some undesirable side effects. Common side effects: allergic reactions, hives, shortness of breath, facial swelling, lip swelling, tongue swelling, throat swelling, dizziness, slow heart rate, leg pain, pelvic pain, body swelling and increased sweating. Serious side effects: bleeding. Aggrastat increases the risk of bleeding, which may even be life-threatening. Signs of bleeding may include easy bruising, nosebleeds, bleeding gums, bleeding around catheters. Hematologic adverse effects: the drug can decrease the platelet count in the blood, leading to bleeding. Precautions when using Aggrastat. Alcohol can increase the risk of bleeding in the stomach and intestines, so it should be avoided while taking Aggrastat. Medications that may interact with Aggrastat. Clopidogrel. Using Aggrastat and clopidogrel together can increase the risk of bleeding. Precautions when using Aggrastat. Aspirin. Using Aggrastat and aspirin together can also increase the risk of bleeding. Heparin. Using Aggrastat and heparin together can also increase the risk of bleeding. Nonsteroidal anti-inflammatory drugs. NSAIDs. Using Aggrastat and NSAIDs together can increase the risk of bleeding. Precautions when using Aggrastat. Clopidogrel. Using Aggrastat and clopidogrel together can increase the risk of bleeding. Aspirin. Using Aggrastat and aspirin together can also increase the risk of bleeding. Heparin. Using Aggrastat and heparin together can also increase the risk of bleeding. Precautions when using Aggrastat. Nonsteroidal anti-inflammatory drugs. NSAIDs. Using Aggrastat and NSAIDs together can increase the risk of bleeding. Pregnancy and breastfeeding. Consult your doctor before using Aggrastat if you are pregnant or breastfeeding. Precautions when using Aggrastat. Clopidogrel. Using Aggrastat and clopidogrel together can increase the risk of bleeding. Aspirin. Using Aggrastat and aspirin together can also increase the risk of bleeding. Heparin. Using Aggrastat and heparin together can also increase the risk of bleeding. Precautions when using Aggrastat. Nonsteroidal anti-inflammatory drugs. NSAIDs. Using Aggrastat and NSAIDs together can increase the risk of bleeding. General precautions: do not take Aggrastat without a doctor's prescription. Always follow your doctor's instructions regarding dosage and how to take the medication. Tell your doctor about any side effects or symptoms you experience while taking the medication. General precautions: store Aggrastat in a cool, dry place, away from direct sunlight. Keep out of reach of children. Additional information: Aggrastat can be administered intravenously. The dosage and duration of treatment depend on the individual's condition. Your doctor will monitor your health throughout the treatment with Aggrastat. Disclaimer: this article is for informational purposes only and should not be considered medical advice. Additional information: always consult with your doctor or pharmacist for personalized advice and treatment. Further information: how Aggrastat works. Aggrastat works by inhibiting the binding of fibrinogen to platelets, thereby preventing platelet aggregation and clot formation. Further information: when Aggrastat is not recommended. Aggrastat is generally not recommended for patients with active bleeding, a history of severe bleeding disorders, or certain other conditions. It is essential to consult with a doctor to determine if Aggrastat is appropriate for your specific situation. Further information: long-term effects. Long-term effects of Aggrastat are generally not well established. However, it's important to discuss any potential long-term concerns with your doctor, especially if you need to take Aggrastat for an extended period. Further information: monitoring while taking Aggrastat. Regular monitoring may be required, including blood tests to check platelet count, blood clotting time, and liver function. This helps ensure the medication is working effectively and safely.